Sometimes we hear the word spasticity triggers. What are these?
Well, they are very useful things. And if somebody has spasticity or they think they may have spasticity or spasms, then these trigger factors, the things which influence your spasticity, your tone, your spasms, it's very important that we learn to or get to know what these triggers actually are, because these can sometimes help us to cope and manage this condition on a sort of day-to-day basis, or these symptoms on a day-to-day basis. So what we have to do really, what we often do as physios and other healthcare professionals, will try to help you work out what your triggers are. Now, these triggers are numerous and they are very individual and very personal, which is why it's good to know what they are, or it's good to know what the main ones are. But it's also good to try to think if you do get a lot of excess tone or spasticity or a lot of spasms, perhaps what were you doing in those few minutes beforehand, which may have triggered them off. Common trigger factors, probably one of the commonest, is pain. And pain is one of those interesting things because, we think of pain as, cutting yourself or twisting your ankle. But of course, pain can come in lots of forms. And it may not just be pain, it may be something like a sensation, maybe even clothing which is a little bit tight. So increasing the sensation may well elicit a little bit more tone or a little bit more, a few more spasms. It could be pain from a pressure area. It could be pain from an ingrowing toenail. It could be arthritic pain. It could be pain that you don't even know you're experiencing, especially if you've lost sensation and you may be sitting in one position for a long time, and maybe you're sitting slightly on one buttock more than the other and just causing a little bit of pressure pain there. You may not even feel it, but your body, as a result of that, may start spasming a little bit more. So pain is a common thing that can actually make spasms much worse. Sometimes even, excuse me, lying in bed in one position, perhaps on your hip, and you may be starting to sort of build up a bit of pressure there, and you may be asleep and not even realize it until you start to sort of spasm. So pain is a common trigger. Things like bladder and bowel problems, especially constipation, can be a real trigger for spasms and spasticity, or even bladder dysfunction, or even feeling an urgent need to go to the loo. That in itself might be something that actually sort of triggers spasms off. Even things like temperature changes. If you suddenly go out in the cold, you may find that the spasms will, because of course we all know that if we go out into cold weather, we start to sort of clench our muscles a little bit more. You're trying to conserve heat. But that might be enough to sort of trigger the spasms. We also know that if a body starts to warm up a little bit, and only by 0.5 degrees centigrade, the messages along our nerves will start to slow down. So you may find actually if you get a bit warmer that the spasms and spasticity actually reduce a little bit, just because the nervous system has sort of calmed down a little bit. Things like menstruation, if people are coming up to their period, it may well mean, because obviously your temperature changes, the temperature changes in the middle of the months when you ovulate, and sometimes it can be as subtle as that. And you think, oh gosh, why is it that at certain times, in certain weeks, everything starts to go horribly wrong? And it's not until you start putting sort of two and two together. Things like infection or illness, sometimes feeling more spasms or more spasticity, or even the spasms and spasticity relaxing a little bit, can be a sign that you're going down with a urinary tract infection or getting a cold. So infection can also make a difference, because obviously that is also going to affect your temperature. Things like anxiety, and we spoke about walking across a plank over a crocodile infested pond or a 1,000-foot drop. Anxiety will make it much worse. And sometimes it can be, for people with very severe MS, maybe who are having carers come into their home, and maybe there's a carer that's new to them, and they're a little bit concerned about what this carer is going to be like. On that morning, their spasticity might be much, much worse. So all of these things can sort of feed in, things that we're worried about in our family, putting more effort into something. If we're trying really hard to do something, is a common trigger for increasing tone in our muscles. The speed at which we move, the faster we move, often can trigger a spasm or can make spasticity worse. The posture, the way we sit, the position of our head can actually make spasms and spasticity worse. So the thing really is to be aware of these triggers, to be aware of all the different things that can make things better and can make things worse. And I think the best way to actually get a handle on this, and the way that I use with my patients, is I ask them to fill in a spasticity spasm diary. So if somebody has spasticity or they think they are beginning to develop it, and they feel that it's very variable and it may be interfering with different aspects of their life and activities of daily living, I just give them a very simple sheet with, Monday to Friday and morning, afternoon and night, evening and nighttime. And I get them to put on there when the spasms are worse, and the sort of things that they were doing just beforehand, or it may be perhaps when they opened their bowels that week. And if they are taking medication for spasticity, to also put on that diary when they're taking their medication, how much the medication they're taking, so that we can begin to build up a picture with them of exactly all of these different factors which are going to influence their spasticity. And often that alone sounds so simple, but it can be the key to really managing tone and spasms well. So there's a lot that we can do which will sort of help. And as I say, starting at the very beginning, if you like, is the best place to start when it comes to how to manage this condition.